Hi, I'm presenting a case of ACL reconstruction of the left knee, starting with the diagnostic arthroscopy of the left knee joint, looking into the medial gutter, then moving on to the lateral gutter. As the case is an acute case, so probably there's some little bit of hematoma there. Coming back, the lateral gutter seems to be clean. Now looking over to the patella undersurface. Both the facets and apex look good. The cartilage seems intact as such. The lower pole of the patella also looks good. There is no loose body in or synovitis in the suprapatellar pouch. Looking over the trochlea is good. The cartilage is intact. Into the intercondylar notch, as you can see, there is an empty notch sign which presents that the ACL is torn. Then coming to the middle compartment, doing the diagnostic arthroscopy of the middle compartment, looking over to the inferior surface of the meniscus. The meniscus looks intact. Both the superior and the inferior articular surface seems intact. Then moving on to the intercondylar notch again, the PCL looks good, taut. The ACL is torn. Then looking into the lateral compartment, the lateral meniscus, the superior surface looks good, but there is a tear, longitudinal tear on the inferior articular surface. In the posterior third area, the red-white zone. So because it's an incomplete tear, we can directly do a stimulation by doing the trephination with a small needle, so that there is enough bleeding and collateral formation, which leads to good healing in the lateral meniscus posterior third tears. So we make multiple holes in both the fragments of the torn area. Now coming to the ACL reconstruction part, we're doing the femoral drilling with the femoral jig. Then after that we're doing the 4.5 mm drilling. So we're doing the fixed loop endobutton reconstruction with the hamstring graft. So we'll be doing the through and through 4.5 mm drilling, then looking over to the depth of the femoral tunnel. After measuring the depth of the femoral tunnel, then we take the appropriate femoral reamer guide as per the thickness diameter of the graft. We drill it to the appropriate length required as per the length of the graft. The last few rotations can be done through the hand. Then we come on to the tibial tunnel drilling. Put the reamer, we do a sequential reaming, then putting on the graft passage with the fixed loop system. So we pull the graft in, then toggle the endobutton over the femoral condyle. This is the biointerference screw used in this case. This is the final construct after the hamstring ACL reconstruction.